You're listening to Finn Voices on Healthcare Now Radio, where we highlight and amplify the voices at the forefront of health innovation. Innovation that improves people's lives. Join us for an inside look at the changemakers driving conversation and answering the most important questions in healthcare today.
Welcome to Finn Voices. I'm Beth Friedman, Senior Partner at Finn Partners, and I'm based in Atlanta, Georgia. Today, I'm joined by Ryan Kelly. He's Senior Director of Content and Growth at Trek Health. Ryan has spent the last 6 years at that intersection between healthcare and sort of high-tech growth companies. He's watched a lot of federal policies change and new data come into our industry, unlocking some intelligence for us, but more data doesn't always mean better information. I heard that actually from a CIO last week at a conference. But in this episode, we're going to get real specific on data as it relates to payer negotiations and some exciting new things that providers can put sort of into their bucket or their arsenal as they have negotiations with their payers. This data, that's transparency and coverage data, TIC. And we'll talk about that and how it's really helping to sort of level that playing field between providers and payers. So, Ryan, happy to have you on the show.
Thank you, Beth. I'm excited to be here today and, talk a little transparency and coverage and how Trek is playing a role.
Absolutely. I had the chance to actually be in person last week with your CEO, Dilpreet, and we had a similar conversation. So I look forward to having it with you as well. So Ryan, on Finn Voices, we talk a lot about data in healthcare. A lot of times it's about clinical data. Sometimes it's about like patient-specific data, SDOH data. This is a new one for my audience. So transparency and coverage data. Can you tell us what that is? And kind of what's new with it and how providers are taking advantage of it.
Absolutely. Yeah, it's a great place to start. Not a surprise to hear that transparency and coverage is not a regular topic of yours. When you think about transparency and coverage, when you hear the term, where your head should go is the published commercial rates that healthcare providers and payers have agreed upon. So a few years ago, back in 2022, there was some legislation that was passed that enforced the publishing of commercial rates between providers and their contracted payers. There was a few primary reasons this data was originally pushed into the public, one of which was the patient experience and allowing them to have, a commercialized experience and, the ability to research particular rates that providers, are offering. There was also a lot of utility in the health tech and aggregation space. The reality is when this data was published, there was not a ton of utility. Payers released this data in a way that satisfied the requirements, but did not really level the playing field like you addressed early on. And so what organizations like Trek and others have done are build these aggregation engines that are absorbing thousands and thousands of negotiated rates every month, every quarter, normalizing them and putting them in a format that really creates action for these provider organizations. And that is where the needle has really moved over the last couple of years as it relates to TIC. It's the transition from being publicly available to having a certain level of utility that has really allowed providers to take strides they would have not otherwise been able to accomplish at the table with payers.
So what I heard you say is that when this first came out, and I remember that regulation, I remember the conversations around it. It was check the box compliance, but not necessarily make it useful or valuable to healthcare provider executives and finance leaders. And now what Trek's doing and some others is starting to bend that curve to where let's take that information, let's make it useful. And let's provide, to your point, the word you used, I think, was utility, which is great. Let's provide an actual tool that we can use during payer negotiations. And providers certainly need that. I know when I'm part of the Georgia HFMA, when I have conversations with my committee, they love this topic. They're like, yeah, anything we can get our hands on to help us in our payer contract negotiations is just wonderful. So let's go there. Let's talk about sort of that practical application of this. Give us a scenario, like explain some specific ways that a health system contract manager or finance manager, whoever's kind of working on these negotiations, how would they use this information?
That's an excellent question. And there's a ton of we're gonna continue to circle back to the word utility, but there are a ton of use cases for this data. The most common is payer negotiations, right? When you think about a managed care department or a managed care leader, historically they have had very little data to back up the assumptions they're bringing to the negotiation table. They have had their internal claims data, right? And they have had Medicare and Medicaid data that they could use as compasses to guide their negotiations. But when you think about the ability to really have a deep dive competitive market analysis and understand who the primary provider organizations in your zip code, in your city, in your state, what they may be receiving compared to you for a particular service line, for a particular specialty, really gives you the authority you need to bring data-driven claims to the table, right? A couple utilities that Trek users commonly have are that competitive market analysis I mentioned, really understanding folks within a particular geographic range. We have a tool that we just call rate change. Rate change is very commonly used to understand particular movement as it relates to a particular CPT code or service line. There are some customers of ours that are really interested in deep dive understandings of a particular CPT code and really want to zoom in. So I think it's the ability to zoom in and tap in on the particulars of these contracted rates that are really moving the needle for our customers. And the data is complex, right? And it takes a certain level of familiarity to navigate and to have that action, to be in an actionable place. And so what we and others have done is, create an ecosystem that allows the everyday managed care professional to navigate this data and bring findings to the table.
Yeah, it sounds like it could be so useful. And when I worked in the hospital, I didn't even work in this area. So I'm learning all this new and fresh, but just curious, how often are these contracts negotiated? Is it an annual thing? Is it more often than that?
Many times contracts are negotiated at the specialty level, right? So you could be negotiating with one payer regarding various specialties all year long. Every provider has a different set of circumstances, right? And I think it's up to these partners like Trek and others to meet them halfway and really be that partner and not a vendor. So the complexity of their negotiations, the frequency, their payer mix, these are the type of circumstances that create a complex, dynamic environment that warrants the white glove treatment that we and others provide.
Yeah, it sounds like it. It sounds like there's a lot of nuances and a lot of variance,
That's right.
which, you could say that about a lot of things in healthcare, but when it comes to how much money am I going to get back or how much am I negotiating you're going to pay me, understanding and being able to navigate all that is certainly super important.
Yeah, and that's a good place to double tap on. I mean, the reality is the outcome of these negotiations have a direct impact on their revenue and bottom line, right? And what you do with that increased revenue is ultimately up to the provider organization. But when you think about reinvesting into the patient experience or the outcome of patients or the quality of physicians, the quality of equipment, right? There's a lot that can be done when you can optimize negotiations with payers.
I've got two questions in follow up to that one. The first one is just you don't have to give me very specific names, numbers, or anything like that, but in general, the hospitals and health systems you work with, what kind of improvements are you seeing in what they can negotiate, like better terms, better rates, or is it a combination?
We've seen a lot of really unique success stories. I spoke with a customer recently that was able to have upwards of a 30% rate increase with a very recognized payer, right?
No
Which is
names.
which is a massive win. There's a case study in the works, so I'm gonna reserve names for the time being,
Fair.
just to respect the process. But that's an excellent example of you don't know what you don't know. And they didn't know how far behind they really were, right? They didn't know how much ground they had to make up. So once you have a true lay of the land, you can start asking the right questions and you can start picking the right battles, right? And they have used this particular increase as evidence for other nationally recognized payers to, impact service lines that may have higher patient volume or more regular claims being processed, right? So it's a compounding effect. As you win in one particular contract, you can, this additional leverage can now be, you know, used throughout the rest of your negotiations.
Yeah, for sure.
Additionally, we have customers that really enjoy leveraging this data for expansion opportunities, whether it be taking existing services into a new market or
Mm.
expanding service lines within an existing market. It really gives you the opportunity to forecast financial outcomes based off of a particular patient population and the frequency of visits. You can determine whether or not this is a worthwhile investment or not, and understand the complexity of the environment you may be entering.
Before you launch a whole new service line, say.
Right. And we do have an example of a customer of ours that was able to open 3 new urgent care centers all across northern Arizona with this particular set of data. So payer negotiations have and will continue to be the number one use case for this TIC data.
Mhm.
But I do see emerging, secondary and tertiary use cases that have a ton of utility for these provider organizations.
One of the things you mentioned was, taking some of those savings, or I don't know if they're savings, but they're improved revenue, right? More
Right.
revenue. You're going to get
Right.
taking that improved revenue stream and applying it toward other things that are patient facing in your organization. You mentioned that in response to one of your questions. I assume that's like we talked about opening new service line expansion, but new equipment, just being able
Right.
to serve your community better, which, I know all providers are striving to do, especially given some of the reimbursement cutbacks are already starting to see. At a conference last week, provider up in Ohio, a small health system, told us that in January alone, they've already seen a reduction in patients with coverage, with insurance coverage. They have more self-pay. And in their situation, they said self-pay usually means no pay. And they're seeing fewer visits, like the volume. So patients are also not getting the care they need. So we're already starting to see that. So I think more is going to happen in that regard too. So very, very interesting. What about, let's talk a little bit about, you mentioned using this data for other things going forward, beyond the negotiations. I think you had mentioned pharmacy to me at one point. So tell me a little bit about that.
Yeah, so there was some pretty exciting news that came out a few weeks ago now related to PBM, pharmacy benefit management, and the disclosure of their rates, right? And this is going to open up a whole new set of data that has historically been not subject to the TIC regulations that have been in place. So it's one more piece of evidence. It's one more data point that can be ingested, layered on to the negotiated commercial rates, and just brings another level of utility and action for these provider organizations. I think that we will continue to see additional data sets required, and I think we're going to move from the carrot to the stick relatively quickly. There has been solid momentum in this space for the last 4 or 5 years, and capitalizing on that momentum and continuing to bring transparency to healthcare and healthcare pricing is really critical. So PBM was a recent announcement that's very exciting for the space. It's exciting for organizations like Trek, but also the end users and the folks that are going to get real utility from a new level of understanding.
And just to reiterate, for the listeners, TIC data is transparency and coverage data, TIC. And as we've been talking about, it is something that's been out there for a while, but hasn't been as usable as we would like. And now we're starting to see that shift, which is really good news for providers. I'd like to maybe wrap up with a little future casting, if you don't mind, Ryan.
Of course.
I was just at the Vive conference, and I expect the same at the HIMSS next week, where data, I even call it healthcare's new 4-letter word. It seemed like every vendor at the conference had data in their booth. It seems like everybody's there, right? We're all there. We're talking about it from so many different approaches, so many different angles. data analytics, intelligence, it's all evolving so fast. And I think these new technologies that are coming down the pike, the two letters AI, and others are going to just propel all this in many ways we can't even imagine right now. So when it comes to this TIC data, or the transparency and coverage, do you see, even beyond what you guys have done already, where do you see this going, say in the next rest of this year and even into next year?
So I'm going to lean into the two letters as well, and more data to answer this question. AI has a pivotal role to play in healthcare. I was at HIMSS last year. HIMSS, it was last year or 2 years ago, and there was a gentleman on stage that said, if you can find a way to deploy AI today and get real value from it, imagine how you can compound this over the next couple of years. And when I look back then compared to today, like how right he was, right? Trek is doing some really unique things with TIC data. And the reality is TIC is an excellent foundation, and the ability to drill into the granularity we discussed earlier is exceptionally valuable. Now, the next layer of value is really personalizing that on a contract level. So we're doing two things at Trek to continue to move the needle for these managed care leaders. And that is one, ingesting and integrating their individual contracts and layering our TIC findings on top of these specific contracts. This is going to allow for very personalized and specific negotiation optimization. It'll allow you to understand where you should focus your time and energy, where you might, if you're at top of market for X amount of service lines or CPT codes, let's address the areas where we're not, right? So really layering this intelligence into these particular contracts and allowing the users to interact with this data, ask specific questions, understand the intricacies of a particular set of language, cite the source of where contract intelligence response is coming from. So the ingestion and layering of this data into particular contracts is going to be a really important next step. And the second ingredient there is going to be policy updates. One of the biggest drivers of revenue for these systems, and what creates a lot of internal headaches, is the amount of policy updates that these payers are publishing weekly. They have a direct impact on the negotiated rates, on the negotiated contracts, and oftentimes are difficult to find, and the repercussions of them are difficult to understand. What we have done is recently launched a tool called OpenPayer. And what this is doing is ingesting policy updates on a weekly cadence and allowing the user to, again, interact with this database to ask very specific questions, whether that be about a particular payer, a particular geography, a particular service line, and really understand how day-to-day, week-to-week, these policies are going to be impacting revenue cycle, claims, managed care, patient intake and experience, right? Like there's a bunch of downstream repercussions of all of this. That's where Trek's going. We believe that Trek's unique in this space because we are built for provider organizations. There's plenty of alternatives out there, right? But they're building a solution for the broader healthcare market. Trek has chosen to really zoom in on provider organizations and be that partner and build a technology stack and platform specific to their day-to-day needs and the unique workflows that they're required to accomplish. We look forward to ingesting these contracts, to bringing a new level of insight and utility to these organizations, and then being that policy partner and making sure that they understand when, where, and how policy updates are going to impact their day-to-day.
Ryan, let me drill down just for a minute on something you said, and that's you called policy updates. So I am a former medical record coder, and I know the impact of changes on coding and billing and denials and that whole revenue cycle, which you alluded to. When you say policy updates, do you mean things like that? Like, well, for this knee surgery, knee replacement, I as the payer am now changing what I need for prior auth, or what I need documentation for, what codes I need in order to reimburse correctly. Is that the kind of policy changes you're talking about?
Exactly right. Yeah, those are all great examples. OpenPayer as a solution is really broadening who we impact within a provider organization. Historically, Our solutions have been very geared towards the managed care, payer relations, finance departments that are doing the forecasting and analysis of these contract negotiations. Open payer and the idea of policy updates really impacts a broader set of departments and employees within a provider organization, right? We're looking to, again, bring utility to anybody and everybody that is interacting with a contract, right? If the contract is part of your day-to-day workflow, you have questions about the specifics or the intricacies or the impact of this contract, Open Payer addresses the policy update aspect of that. And contract intelligence is going to be the solution that gives you the personalized set of information you need as it relates to your contracts in relation to TIC.
So a lot of these downstream employees, can I say, or even your back office, or the people doing the actual work day to day. And I got to tell you, Ryan, it's been a busy week for me. It's kind of overwhelming because we're all getting ready for the big HIMSS conference. That's probably as a former coder, and I have worked in billing and business office and the whole cycle. That's the best news I've heard all week.
I'm happy to be the one to deliver it to you. That makes me happy. It's exciting. It was just a recent announcement. We're learning a lot right now. We're gaining some good adoption. What's unique about Open Payer is it's also a free tool. We're trying to democratize the idea of policy updates. There should not be a barrier of entry. It should be easy to find. It should be easy to query, and it should not be something interrupting the efficiency within a provider organization. There's plenty of inefficiencies that need addressed, and this is not. This is one we're hoping to nip.
I'm just going to, since you did say that you are provider focused, I'm going to maybe just make a guess that perhaps payers have kept some of these policy changes complex and hidden for a reason, but I'll just leave it there.
Yeah, I think the day-to-day professionals know where to look, right? Yeah. I think for somebody unfamiliar with the space, if they were asked to go find the most recent United Health policy updates, it may be difficult, but that does not negate how dispersed they are and the variance of format and how difficult it is to query and interact with them, right? So earlier in our conversation, you mentioned the idea of we're impacting revenue, right? Which is absolutely true. But when you think about time savings and efficiency gains, there is a cost savings aspect to TIC and contract intelligence as well. Exactly. And I think this Open Payer plays a big role in that.
Where can people find more information about it on trekhealth.com or a different website?
Trekhealth.io is going to be the home base for all things Trek and our TIC solutions, transparency and coverage solutions. Again, Open Payer is a free to use tool. You can find that at openpayer.com. And we are very active on LinkedIn. Consistent profile. We really do attempt to be thought leaders in this space and be more than a vendor, consults, a partner, and the organization people come to when they think of transparency and coverage and payer negotiations.
And I know you'll be at the HFMA annual conference in June.
We will. Looking forward to exhibiting and meeting more of the community and continuing to promote the killer solutions that Trek has developed.
And I first met you because I attended one of your CEO sessions at HFMA 2025, which is how Got Connected. And when I heard your CEO speak, I was just really inspired by the good work you're doing. So thank you for all that. Thank you for being on my show today on Finn Voices. You can reach Ryan, as he mentioned, on LinkedIn, Ryan Kelly. Learn more about Trek Health at their website, and it is TREK. So Trek, TREK Health.io is the website. And Ryan, just thank you for being on the show. We really appreciate your time.
Yeah, thank you so much, Beth. It was awesome talking with you.
This has been Beth Friedman, Senior Partner at Finn Partners. I thank you for listening to Finn Voices, where we talk about health information, health innovation, and all the technology in between.
Finn Voices is brought to you by Finn Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact for the world around us. Learn more at finnpartners.com and follow us on LinkedIn at Finn Partners.